Fine, so good evening, everyone. We'll discuss this topic AI in medicine, and I have purely kept it as an exam purpose. How to write a short note. Okay, so let's be straightforward to that. Otherwise, if this topic comes and if you're not even ready for short note, that is going to happen in exam for sure. Out of 10 question, maybe two or three we are not ready. So most of the time approach is write something, and if you really want to write something, the first idea always comes, make a outline in which you are going to write your answer. That will actually keep the information flowing, whatever you have read, whatever you have heard. And that's the approach to theory exam most of the time, that if you have outline ready, then most of the time things fit and you get the marks. Okay, so this is more for, I would say, the exam answer. Otherwise, this topic is beyond like discussion for 30 minutes or 1 hour. I have some 42 slides, and we will find a mechanism where we can share this slide as a PDF so it can help you, and we will see what can be done based there. So let's start our class. This will be the outline of discussion. We will understand few terminologies. We are not data scientists or computer engineers, but now everyone use something called ML and DL and all those things. So let's start assuming things and let's start learning. Okay, this is what it means. It's not something we are going to do masters in that. Our masters is in medicine. So let's focus on medicine more. But let's try to understand, because this already exists in practice nowadays, and we all are exposed to that. Okay, we tell or not, we are exposed to that. So we'll start with terminologies. Followed by it, we'll have this timeline of the landmark event, including that AI is now a theory question. Okay. Then we will see the potential of AI in healthcare directly, where we can see in diagnostic, treatment, precision medicine, and in clinics. Okay. And then we will go for potential of AI in healthcare beyond those things, like in clinical trials and all, and how it can help in prevention and all. Okay. So that is a population level management. And what are the problems? Okay. See, if we have this outline ready, we can make a summary of this and we can write the short note. So, the topics which are difficult, new, and all, this is the overall idea. You should know that how you will make a timeline of any possible topic, or if you can write this outline, you are mostly clear. Okay. So now we will start first thing with the terminology. This is not something, I'm not computer scientist, I'm doctor like you, but this is basic. We understand everyone use AI. Okay, somehow or other way the AI is in use. So let's start first with terminology. So the basic meaning of AI was, or the basic function was, creating machine which is capable of intelligent behavior. Okay, it's like a residency training if you are machine. Okay, so they just want to train you to the level that you can treat intelligently. Okay, so that's what now we are getting through machine, not the human. That is the basic difference. It's that is what the artificial intelligence in a true term means. Okay. Now then there are certain layers, like there is something called machine learning. Okay. So it learns from the pattern of the data. Like we use all the social media, and the way we see things, we get more inputs and all. That's a simple example. So to make prediction or decision, it learns from the existing data. That suppose if you are following 5 6 channels or 5 6 people, accordingly you get your content there, right? So that's what is happening. Then it includes few categories, like it's a supervised learning in classification and regression, it's unsupervised learning like clustering and dimensional reduction, and then the reinforcement learning, which is sequential decision making to maximize the reward function. Now if you really see, you are actually doing this while training. Okay, so this is nothing AI. If you really want to write, just consider your training program and put a machine instead of a human as a resident. Okay, they treat us like machine sometime, but that is what is happening, right? So it's either supervised, unsupervised, or reinforcement learning method where machine learning comes in picture. Now in machine learning, we combine with a given data set. It's an artificial neural network. Okay, now whatever we search on the social media or the other parts, and then you see that on Flipkart or Amazon or something similar kind of things are coming. Okay, they have one information, now algorithm is catching it up. So these are just examples. It is beyond, it is not as simple as we tell, but this is what that when the machine learning is with artificial neural network, which may be interconnected processing nodes in multiple layers, it becomes deep learning. Okay, so this is the more important point, what is happening in last 10 years. Up to machine learning 2010 we were there, but we were not discussing much because this layer was not there, that providing a data and let the machine do its job connecting the things. Okay, so it includes convolutional neural networks, recurrent neural networks, transformers for the language understanding, and generative adversarial network for creating new data. So this is the part which has come little more beyond the machine learning when it comes to this, right? So even if you experience your Amazon, Flipkart, what you were using in 2015 16 also, and what you're using now in 2014 2024, right? It's entirely different. Sometimes it happens, I'm just was thinking about the product and it pops up, okay, that you need this. I don't know why it happens and all, but subconsciously those all reflects what we are doing and what we are saying. Maybe they are listening to us right now also. Okay, then comes the NLP. This is very important, a natural language processing, because we all had that argument that AI, no empathy, no emotions, nothing, right? It does not sound like human. Fine. Specifically, when you have that rocket logo with any text, mostly it's AI generated. We have figured out. We also make those text, so we know that this is how it works. Okay. When you use ChatGPT and you ask that to add some emoticon, there are five, six which is GPT's favorite. So in that also you are finding pattern, and then you have to tell GPT, don't use that, please. Okay, so this is how it happens. So the NLP is understanding, analyzing, and generating human language. Okay, because there are certain studies, or if you've heard about this, that now AI is talking to patients in more empathetic way than a doctor can talk. Okay, that's in a way right. We have those mood things. Okay, while AI is AI, it's okay. It does not take that. So this application of natural language processing includes machine translation, text classification, sentiment analysis, named entity recognition, question answering, and conversational AI. You try with Siri. Okay. You will actually get this. You try with Siri that give some odd commands, give some command which sounds in different mode like anger and all. It changes its tone in a way that it can interact with human, right? So this is the typical what we get. Siri is the best example to tell, which comes with natural language processing. Then comes the computer vision. It's more about the images, the object detection, image segmentation, facial recognition, right? We open our mobile with that most of the time, medical image analysis. Still, there are few tools which are really good with this, but otherwise, your general this AI models are not that great with image. You have to pay for that. Okay, so there are certain programs which are paid and which does amazing job with the computer vision. Otherwise, not that great. Okay. And the last is the expert system. It's more of a rule based AI system, that if this is the answer, then you do that. So if then rules it applies, and like a decision making of a human expert. Most of the programs now it's running. Like suppose the example is you visit one site and you have clicked that product, you immediately get the message that this is the product and these are the other options and this is ongoing sale or something like that, right? So it's a if then there are so many algorithms. It has been attached with WhatsApp, Gmail, everywhere. The same can happen when patient data, suppose BP comes this much alarm bips, right? And then it interprets in the context of the total patient that this can be the possible causes. So this is the expert system. Now this was the only part of the lecture which was more on technical part, and this is the summary of this. These are the five aspect of AI we understand: machine learning, deep learning, natural language processing, computer vision, and expert system, right? So machine learning is all about connecting data. Deep learning is machine learning plus a neural network which exists and then making or generating data. Even natural language processing is all about the Siri part. Computer vision, if you see, it's a digital image and all this generation. And expert system is more to set algorithm for if and then rules. Okay. So if we have this idea, these are the five components or the five technology which are predominantly described and used as a AI part. You introduce this in your half of the page of answer. I will be little exam specific here. Then you go to the application, which was your plan. Okay, now you know already. Even if you're not read anything about AI, each subject you add something. Suppose if I'm talking about rheumatology in AI, it can analyze ANA pattern and give the differential. It can analyze history and tell the differential. That's okay, fine. It can help that which immunomodulator will be best according to patient profile, depending of analysis of all data. That's what I do. Okay, but now machine will be doing. So what you are doing, put into the machine context, your short note is ready. Okay, I will give few examples and then we can summarize, because these are the examples where evidence already has been generated. There are paper published with that. And if you really read few papers, they have clearly mentioned one of the co-author is ChatGPT. Okay, that we have taken assistant or they have acknowledged that part. Okay, so journals are also scared now who is writing what, right? Fine. So now this is the second part what we are going to go. I think this terminology part is clear, and I am really sure this is not something we are doing a medicine or intellectual discussion of our routine practice. So if any doubt arise, I am not the expert on AI at all. Okay. We do use, but right now our use is very primitive when it comes, because right now we are happy with what we have already. Okay. So maybe 2 5 years down the line, I am not sure that how much will be required. But right now things are comfortable and we are getting enough patients without AI, so things are fine. Okay, so now we go for the timeline of landmark event. I shared this slide on the group also. So it is every 10 years they have written that it started somewhere from 1950. It was a Turing test for that, and that is something that machines behavior, machines ability to exhibit intelligent behavior, through that they analyzed. And in 1956 there was the first kind of conference and the artificial intelligence term was coined. Then came the next era of 1960-70, that the chatbot came in the picture and the expert system came in the picture. Okay. So that was the Eliza was the first chatbot. Please do not ask it as MCQ. Okay, that can happen, but that was a thing. Then came the 80 to 90 era, where the ML and neural networking came. Okay, where I think people like me when we were born. Okay, so IBM had the Deep Blue bits, which actually had beaten the chess champion. Okay, so the computer was like better than performing. And then 2000, it was more about virtual assistant, the Siri like thing. And 2010, what I told the last 10 years, what has come is a deep learning, right? So the existing neural data and generating new data. And 2024, a major event happened that it started coming in exam and we started taking classes on that. Okay. So this is the milestone. If you really want to remember, or it's okay, 10 years you put something, that becomes the second portion of your exam answer. First was the introducing to the technology, what we already saw. And then second was the timeline of the landmark event. Now we'll go to the third part, which is quite important. The potential of AI in healthcare. Okay, like right now, what examples I'm going through for next 10 or 15 slides are the direct examples. So we'll go with the system sometime, that these are the initial things what we can think of in exam answer as such, where it exists. That it helps in diagnostic accuracy and efficiency. It helps in personalized treatment. It helps in patient engagement and adherence. Many of the reels or the social media content what you are seeing, it's a gift of AI. Okay, it just makes the flow easy and people can do it easily. Optimizing clinical operations and resource allocation, drug discovery and repurposing. Many of the articles now, as the data processing has become quite easier, the drug discovery article have actually increased to get published there. And then population health management. And then last is the clinical workload and burnout that can be handled. I'm not sure burnout will be little different at that point, right? That patient AI ले गया तो क्या करेंगे? Okay, fine. So this is the future, but let's see how we can go. So first is the imaging. We all have heard that the radiology, the trial which was done in China, the CT interpretation was better than humans or better than the radiologist. Okay, this all are heard. Okay, and they exist. That radiologist level performance in detecting breast cancer on mammogram, lung cancer on CT scan, and skin cancer on dermatoscopic images. So that AI can do equally or at the level of a physician or the qualified physician, what we tell. Okay. So it can also quantify tumor burden, it assess treatment response and predict prognosis. So our radiology friend, he does the same job, that he will be getting call for the CT perform, and then he will be telling that compared to the previous CT scan, now this has been improved. I think treatment is working and this is the prognosis now. Okay, now AI can do that. Okay, but still he does that. Fine. So this is something that it has been proven not yet approved. It cannot be generalized very easily because there will be lot of variation and there will be potential biases, right? For human, there are tendencies to talk and tell that, okay, this does not fit. AI gives the report and it is done then. Okay. So still people will, right now I will doubt AI more compared to a good radiologist whom we know, right? So that is a thing, but future may be little different. So first is your radiology. Okay. Now let's apply it to pathology. Pathology also they can do that with the given slides. If that can be digitalized, that's a hurdle there. Okay. And it can be validated by regulation, and then it is a clinical workflow. If all these things work, it can help to detect cancer, classify tumor subtype, and predict molecular biomarker. Okay. So it increases the efficiency and reproducibility and access to pathology expertise, right? Most of the time we send biopsy and we tell patient कि अब 10 दिन wait करना पड़ेगा, 14 days wait, or sometimes 3 days wait, right? So that is the point where the machine can really help if we can take care of this part. Okay. So whatever I've introduced, it is in the same theme. You take any field, write what AI can do, and think what challenges exist. If you can make that, then things are easy. So think first radiology, think pathology, then think microbiology. Again, there are studies which has proven that blood culture and the gram stain analysis it can do as equal as we can do. Okay, so deep learning, these are things possible. It can identify pathogen, predict antimicrobial susceptibility, and by combining all data it can actually tell clinical outcome which is possible. So the key application will be sepsis diagnosis, outbreak detection, and antibiotic stewardship. That is what we are supposed to do, but machine can do for us, right? And these are the challenges: data integration, model interpretability, and clinical validation. You just imagine the reports what we give, right? And then you can find key, if that data is going to be fed with the AI, the humans have more chance, right? We can win over AI in stupidity. No one can beat us, right? So that is still okay. The reports we see, sometimes the blunders we see, if that data is going to go in, I'm not going to rely on AI. Okay, we are going to rely more on the clinicians or the people who are actually trained well with that. But when your data is authentic and genuine, the machines will perform better without complaining much. I am available. That will be the answer there. While the humans, we get different answer key. Maybe day after tomorrow, maybe let's see after weekend. That's okay. We also do answer like that sometime. But this is what can go there, right? So first was radiology, second was pathology, third was clinical microbiology. Now let's involve cardiology. ECG interpretation, specifically for arrhythmia, ischemia, structural heart disease, and the signals, right? Like you have this Apple Watch, then you have those machines where you just upload the ECG and that gives the interpretation. Even now, when you are printing the doing the ECG and the machine prints that ECG, it will give some things, right? So that was existing in my time also, 2013 14, when I was doing MD. The ECG machine used to give possible abnormal ECG, look for this, look for that. Certain diagnoses were quite clear, like ST elevation, atrial fibrillation. So machine learning was there that time. It is not something. Now it came into short note, right? Before that, things were there. Okay. So this is in cardiology you can write, and it is really helpful when there is a low resource setting. There it can actually help a lot. Okay, and that is happening, right? I think we all will be getting few ECG in a week from friends or relative or someone, that where you do not charge for consultation, you interpret that, right? So that does happen with doctors. Okay, we get so many repeats, and sometimes okay, you just guide them, okay, this is what is needed, and that's the best you can do as a doctor. Okay, but don't make it compulsion that you have to guide it, right? You are professional, right? So this is very important, that this technology can really help patient if they are not taking advantage of the doctor. Okay, so that's what we will keep in mind all the time. Okay, because we are responsible for what we advise. That's why I asked that, no, if academic discussion, well and good, we are always available. But in patient care, it is very difficult to comment, because it is someone's life we are taking care there, right? So it can be not be done loosely. Okay, let's just ask GPT what doctor has written and what whether the doctor is written right or wrong. I will say go to your doctor, be little bold and ask कि डॉक्टर यही चलेगा कि कुछ और पूछता है. That's a better way according to me at present. Okay, so this was for cardiac. Now we come to the clinics, like in emergency medicine, it can help in triage. Now people will start fighting in India, right? कि how machine can do, I am not the first, right? So we only have to do the triage. So it can help in the triage. It can actually predict ICU mortality, length of stay, and readmission risk. This is scary, right? If a patient has access to this or all the data, they'll be scared in a way, and they'll be fighting the hospital से तो change करो डामा ले लो, right? So that anything can go bad. Okay, this is really important. It can help us for the critical finding on X-ray, CT scan, fundoscopic image. Okay, and fundus I will give AI more credit. Okay, we are not that trained in fundusing. We are even not trained to carry that ophthalmoscope. Okay, so if you are carrying and seeing, really great. We carried as compulsion, we tried to see few, but when coming to practice, then it went away. Okay. And now my ophthalmologist friend detects whatever it is. Okay. But that's what happens. Certain things are really important if we can make a diagnosis. A neurologist will differ with me in any other basic tool have we have to carry it. I respect that. Okay. So, but in practice, things keeps changing. So start learning to learn that the machine is not going to do mistake. Okay, so that is the important point. Okay, so this is for emergency and critical care. In neurology also it exists. There are already trials that for Parkinson's, multiple sclerosis, and Alzheimer's, if we give them multimodal data like imaging, cognitive test, and CSF biomarker, it can actually predict what disease patient have. Even with deep learning, your scan reading becomes quite easy. It can also predict the seizure risk, deep brain stimulation parameter, and brain computer interface it can establish. Okay, so these are the neurology part it can have. Then in psychiatry, that's a most amazing field and should not be replaced by AI. This was the part we always thought कि यार ऐसे OPD करना है, right? But we cannot do as a physician, we cannot do, but this would have been the dream. But now this is also machine is doing. Okay, so it can identify the pattern of mental illness, and see it identifies depending on your speech pattern and social media activity. Okay, so what I'm speaking right now and what I've scrolled throughout the day, they will get I am mentally fine or there is some illness or something. Something will come definitely. Okay. Someone taking class at 9:30, some illness should come. Okay. So now again the smartphone can help on passively collecting data to see your mental health. How is your activity, sleep, social interaction, and all. The main concern of this psychological part where people are really woke about that is the privacy, consent, and the potential for misuse that can happen, right? That if someone is an election candidate and if this all data are there, so already we are seeing that in the picture, right? So it can go right, but it can go wrong also. Okay, now comes the treatment part. Pharmacogenomics itself is a short note. Okay, it is nothing but the analyzing your data on your genome and to find whether how much percentage of chance you have for response or the adverse event for that given drug. Okay. Now to analyze this much data, it is difficult by the human, but machine can do it very fast. So you can individualize the care if you really have good data. Okay. So database is a current challenge. If that is there, things are fine. Okay. So whenever you hear about AI, people will keep using that phrase, garbage in, garbage out. Okay. That is very important. What you feed AI, it will interpret accordingly. I have tried so many times those things with the GPT and all. Okay. That if you really give the wrong history and all, and then if you guide, ki, no, no, you are right on this should be like this, after some time it will start agreeing with you. Okay, but the best part is it can learn from the collateral sources. Like there was a joke initially, maybe this was 4 6 months back, someone actually asked that what is the treatment for tuberculosis or something, and TNF inhibitor was one of the answer by GPT. So we started laughing, right? Like a human tendency that GPT is a fool, how TNF inhibitor it actually can cause TB and all. Now you ask GPT, it will actually give you better answer with evidences. Okay, so that's what happens, that it learns from the collateral sources and the fun what we make. And now don't tell me we do same in residency. Okay, so that's okay. Somehow the sarcasms are for those reasons. As a staff we have given, we have received as a postgraduate, but that's what happens with the treatment part. Then comes the radiation oncology. Okay, so it's again the exit tumor segmentation, treatment planning, quality assurance that radiation therapy is going to go good. So it can actually do the precise targeting of the tumor through radiation oncology with this part. And again, a precision medicine in an overall concept. Okay, the pharmacogenomics was one concept, precision radiation oncology is one concept. Now, the precision medicine is something I have discussed this many times that we divide layers in the body, that whatever information we have is a genomic. After that, whatever gets to the translation through RNA is a transcriptomic. Now, this RNA makes protein, that is proteomic, right? And this protein does the metabolism and all the function of enzymes and all. That's metabolomic. Now you have gut microbiota, which interact with all these things, which is called metagenomics. Now, this genomic, transcriptomic, proteomic, metabolomic, and metagenomic interaction, everything total in context of environment where we live or where we interact, is called system biology. If you can understand system biology better, the precision medicine can work better for that. Okay, so if you understand this omics, your precision medicine and your system biology, things are easy. That's how it totally works on that. For a given patient, as is genomics, transcriptomics, proteomics, metabolomics, and metagenomics is this, and he lives in this environment, this is the probable therapy which will work best for the given illness. Okay, this is what we want to plan, a very much targeted therapy as a precision medicine. Okay, so that's where also the AI can help. Okay, again same thing, personalized dosing, that you need how much immunosuppression, what is the chemotherapy dosing you actually require. So understanding your body data, it can optimize that part also. Okay, enough now. So as such, what we have seen, that where AI can help, even if you know this or you do not know this, you should have a plan in exam you are going to write it, right? So consider diagnostic like radiology, cardiology, pathology, clinical microbiology, role in emergency medicine, neurology, psychiatry, in pharmacogenomics, radiation oncology, and the precision medicine. Okay, so these are the conventional thing we can think where the AI can be helpful. I have taken this particular things because in the last two recent reviews, one in JAMA and one is in NEJM, these are the field where it has been quoted with the papers that where AI has performed almost equivalent to humans. Okay. Now we go beyond the regular healthcare, which is there in healthcare only, but something beyond what we do not think in clinics much, like a drug trial. Okay. So in clinical trial, it can actually help us to find promising drug target. It help us to find the likely responder and predicting adverse event. If these things can be solved, things are quite easy. It even helps in designing the randomizing ratio, and it stops trial early based on the interim result if we can sense it earlier, right? Before the damage has been done, or before we see the response is really good and the beneficiary should get this drug earlier. So this can really go there. So there is so much skepticism when we come to the clinical trials, right? That companies are promoting this, that, and all. Now, if you really they know the technology and they can actually know by the fundings what they have, things can go crazy there, right? Because in human trials only we are challenging by journal clubs and doing proper analysis. This does not seem as it is written and accepted. There are further challenges. We cannot generalize what is written there. But yeah, with AI things are possible. And there are so many studies published where initially it was just database. Now if you feed database to the proper channel and ask them that interpret this imaging, like by considering that this was already randomized, now classify the patient and make it like a randomized clinical trial, it can actually make. Okay, there will be errors, people will identify it easily, but it can do the 70% job correct. So 30% is nothing. Within 1 year it will be able to do that. Fine. So maybe that's a good scope, that we just do the proper treatment or what is ongoing and then compare it, rather than dividing it like you receive the pill and you do not receive the pill. Okay. So depending on who has received the pill and who has not received the pill, in retrospect, it can design the things like prospective trial. And that design we have applied before the AI came even. Okay. But we mentioned that we have done this data on observation. It was not initially clinically randomized. So many biases are considered and the level of evidence goes little down. It is not as good as the randomized control trial, but the data is sometimes interpretable. Specifically, this will help us in rare diseases, right? If someone tells me that in Castleman disease, do you have any trials? How many patients of Castleman you are seeing? How can you do a clinical trial there easily, right? So there you see is, okay, I have this 30, 40, whatever Castleman disease patient, and they receive this treatment. These are the data. CRP was this. They had this manifestation. CT scan was this. Then they can actually cluster the things. Okay, in this subtype, tocilizumab is better. In this subtype, rituximab is better, right? So then things can actually go there with this part. Okay. Second is what we know is remote monitoring and virtual healthcare. A simple example, the digital watch, right? So it can actually collect all the data, give the signals, and we can timely intervene. Even Apple will advertise on that, right? You detect a fall, trauma, or any abnormal rhythm, there will be a signal sent to the phones which are connected, and you can take immediate action. And then there are certain stories on Twitter and all that it has saved life, right? Fine. So telemedicine and chatbot. Again, right now we will think it little irritating, but it is there already in many of the setup that initial answers comes through chatbot. Like everyone has unfortunately interacted with the chatbot of net bankings, right? And they are so pathetic. And the same is there right now with the healthcare. They do not get the right answers for us, and we always think near koi human interaction ho jaye to in 2 minutes we will solve the problem. But chatbots are yet to develop well. Sometimes the simple queries are getting solved, but not the difficult one, which actually we have, because simple as a human, I think we have intelligence enough to solve that part. Okay. And then remote rehabilitation that also can help a lot. There were many trials during COVID, specifically in myositis and osteoarthritis. This video training of physiotherapy and all, and then depending on the patient response, they modulate the protocol even more. So that all can be taken care. So what I still feel is any task which is repetitive and pattern, okay, that is the medicine training can be done by AI. Okay, if the task has a pattern, steps, you can really divide it in well. You can actually find few components which can be taken care by AI. Specifically, the irritating components, what you want to do, it can be actually taken care by AI. Okay, so that is something which really helps there. Fine. And then the mental health support. I am still not in much agreement of that. Maybe I'm little old school there. If psychiatrist, I want to meet that guy. Okay, I want to talk. That's what. Not online. Not possible for me. But slowly the acceptance will come because the generation is saying the online things are fine. That interaction is fine. Okay. So if that is working, this can really help. Now I have seen this recently on many platforms, including Twitter and all, that if someone is writing that even if they are feeling not feeling good, if they're feeling depressed or something, there are chatbot responses which guide them ki you can consult this specialist and all. And I think there are algorithms which sends message and tell that if you need any help, that these are the available resources. So that's a really great thing to happen. Okay, that could not have been done without this machine learning and the this part that recognize the pattern of what people are expressing, and accordingly actions are actually available, right? So that is something. Try it. Okay, give it a try. Fine. And anyhow, it's exam time, so we can give it a try. Fine. Then the clinical workflow optimization that it just tells, and this is needed sometime in residency, right? We feel that part. But if see, suppose it comes to residency, it's fine. When it comes to job and if you're working for a corporate, it becomes quite difficult. Now the machine will tell me that I'm not working, right? So you just remember Dr. House, how was his reaction with the things, right? And then capacity planning and resource allocation, right? Same thing. That junior doctor is free, give him some work. We have few seniors like that. Seeing us free, they give us some work, right? But that also can be done with AI. And then comes the claim processing and revenue cycle management. Please do this, right? But again, you see the what is the third party involved? The insurance companies. If they know the technology really well, now things are going to get very difficult. But otherwise, there also it can help, right? So it can help in clinical trial, it can help in this wearable device and identification, it can help is in telemedicine, telerehabilitation, mental health support, and overall capacity building and the insurance part. So this is something beyond where AI is helpful in healthcare. Okay. They ask us a short note about AI in medicine. You make it AI in healthcare, or you want to continue with AI in medicine, you can skip this part also, depending on how much time and how much marks that question has. you can fill it up, right? Okay, now I'll go to the almost last part, the population level health management. So this is also a description of that, that actually it can predict things depending on if patient has this diabetes, heart disease, and they have this frailty data specifically on elderlies, that they are at risk, and these are the part the intervention should be there. Okay, lifestyle coaching, medication management, and social support they should receive. Okay, also it can help sometime in signal identification of endemic or pandemics depending on what data is going through the internet and what are the things what people are actually telling, so that it can help in that part also. Okay, and now the last part where we will actually do all the bitching about AI, that AI is not good because these are the things, will you really believe it, so people do not replace us, right? So the first is the ethical and societal implication. That's the most important point, right? That the data is not safe. We are not celebrities right now. Maybe later on few of might you become. So then if your data is not private, then things are not going in a proper way, and it can be misutilized, right? So we need to find mechanism of data privacy and consent. Many times that has happened, I think mostly to us at many places like airport and all, that there will be a kind of something that you get a free coffee today and you enter in that cafe, they will ask you ki bas ye form bharna hai, or you don't give much things but you just press that button, I agree. So when your number is there and you don't know what you agreed for, then okay, because there will be so much things and we are in free coffee. Okay, so if they give you that laddu, mostly they are going to use your data, and the next day you start getting message ki if you have this problem, these are the best doctors, these are the best medication, these are the things, right? So now this is the first part where it comes in the privacy and the ethical part. Then algorithm bias and fairness. Okay, this is very important, the garbage in garbage out wala concept, that if it is not given good information, it is not going to create. And we can manipulate algorithm. You just try it with GPT and all, that 5 6 times you just keep telling, no, this is wrong, I am the expert on this field and this is how it should be done. From six response it will start agreeing with you. Okay, later on it will improve, but at that point it can agree and it can really screw the things. Okay, transparency and accountability, right? If AI told it's a meropenem and you think no, it's a piperacillin tazobactam, then we are at least taking accountability. No, I think, and I have my logics and experience to tell who is accountable when AI is telling it, right? So that can happen really, and that can be the bad thing to happen. Okay, liability and malpractice, again the same thing, that who is liable for this, and this actually can go really bad, that you are not, or someone is not trained enough but can practice what you are supposed to practice with this good degree. Okay, it is happening right now also, people are practicing without degree. Okay, but at least you have कि नहीं वो तो लोग है ना, this is machine which is overtaking us, right? And then intellectual property and commercialization, which also can go wrong, because here there will be a lot of collaboration of academia, research, and the industry. So then things can really go wrong. Few only will get advantage who has higher capacity of investing things, and then that bias will come. So it is not something a problem free solution. It has its own problem. New laws will come and new things will be generated, and things can keep going on. Okay, so this is the summary of whatever we discuss. Let's go with the terminology, then the timelines, then its use in direct, then somewhere in indirect, then at the community level, and then you tell problem with the AI and just summarize that part, and your short note is ready. I hope I have done the job enough that you can write in exam. This was the technologies what we discussed. This were the direct implication what we discussed, and this was so called beyond or the indirect application what we discussed. Before I conclude this class, just a few minutes back, I was playing with my daughter. This is the medicine what she has her doctor kit. Okay, so these are the stethoscopes. This is difficult to replace. This is difficult to replace. Okay, so all the best for your exam, and I hope you'll be able to write on AI very easily. There are many articles available. I'll see how I can share this by tomorrow with you people, and I'll end it here. I hope there is no doubt. Okay, I cannot answer those doubts. Fine, thank you.